Hi, today on Balanitis TV, we're going to discuss an issue that almost no one really addresses. Yet, it's the most common reason why millions of balanitis cases are treated incorrectly each year. Balanitis is a misunderstood disease. This misunderstanding is at the heart of why most people pursue poor treatment options, and it's the main reason why most balanitis cases either keep returning or never really go away. So let's talk about how balanitis is misunderstood by most sufferers. Balanitis literally translated means an inflammation of the glands, or head of the penis. It's this seemingly simple definition that has contributed to balanitis being poorly treated in most patients and millions suffering unnecessarily from prolonged pain. As the definition might suggest, most treatment approaches simply focus on reducing the inflammation of the glands and foreskin. However, equating balanitis to simple inflammation is like calling genital herpes a simple rash. It misleads the sufferer and drives them to pursue ineffective treatments. The truth is, balanitis is notorious for being resistant to conventional treatments. This has to do with how most people, including doctors, look at balanitis. Many people wrongly assume that the inflammation itself is the main and only problem. They assume that once the inflammation is treated, their balanitis will be cured for good. At the outset, it almost seems to make logical sense. You treat an inflammatory condition by simply reducing inflammation, correct? Well, not when it comes to balanitis. While this kind of treatment approach may bring temporary relief, this faulty logic is the main reason why most balanitis cases relapse within days to weeks of stopping treatment. Inflammation from balanitis is a red flag, a warning from your body signaling deeper ongoing damage. Simply treating the inflammation only addresses the problem on the surface without actually resolving the underlying cause of the inflammation. It's the equivalent of constantly using numbing gel for a toothache and expecting the underlying cavity to fix itself. While the pain may temporarily be masked, the damage will continue unchecked until, as in the case of a tooth cavity, it has reached the bone, or as in the case of balanitis, it progresses to cause penile tissue damage. Simply removing the warning sign, the inflammation, doesn't always interrupt the progression of the disease. In fact, it often allows the damage to proceed invisibly and unhindered because you strip away your body's only natural defense against the underlying cause of the inflammation. So to summarize, if you have balanitis, don't just look at it as an inflammation problem. Remember, while inflammation is one of the noticeable symptoms of balanitis, it should never be the sole focus of your treatment. Always keep in mind that inflammation never occurs without a cause, and understanding this underlying cause can help you permanently cure your balanitis. To learn more about these underlying causes of balanitis and how to treat them properly, browse through our other videos. If there's a topic you would like us to discuss, feel free to leave us a comment or email us at help@balanitis.tv. Thank you for watching Balanitis TV.